Hello, my name is Dr. Alex Pavlovic, and I'm a consultant psychiatrist and medical psychotherapist as well as gender specialist. I work for a private therapy clinic. So I've trained first as a medical doctor, and then after some general medical rotations, I went into psychiatry training. My training lasted 8 years. So I first trained as a psychiatrist, junior psychiatrist, and then after that, I've trained as a medical psychotherapist and general psychiatrist. After that, I had some training in as a gender specialist. My training as a medical psychotherapist involved training in psychoanalytic psychotherapy and also family therapy, systemic therapy, and CBT. As a psychiatrist, I prescribe medication, and as a psychotherapist, I deliver psychotherapy. I am majoring in psychoanalytic, or sometimes called psychodynamic therapy, and I do a long-term work with clients. However, I also do formulations, and that is a combined psychiatry and psychotherapy work. And this is why it's called medical psychotherapy, as it involves both prescribing medication and delivering short or long-term therapy. So, in my NHS work, I was initially clinical lead in the team that works with patients who suffer from mood disorders, anxiety, PTSD, and OCD. In the last few years, I have been clinical lead for the team that works with personality disorders and complex trauma. As a part of that, I also work with dissociations and have experience of seeing patients with dissociative identity disorder. As a gender specialist, I assess and patients with gender dysphoria and also initiate treatment plans. I also do second opinions for lower surgery for patients who want to have lower surgery. For that, I am approved by the Ministry of Justice and listed on their website. When someone comes to see me as a medical psychotherapist, I would do full assessment, both as a psychiatrist and as a psychotherapist from psychoanalytic point of view. We would then make a detailed formulation and progress to plan the treatment. That would include both using medication, which I'll prescribe and then follow up, and if the patient requires and feels that that is necessary and wants to commit, I would also offer a long-term psychotherapy. However, some patients want a short-term work, and then I would do something called extended assessment. I would see patient for maybe 2 to 3 months, and then review how their progress is, and either recommend further therapy or we would finish our work there. My main training as a medical psychotherapist was in psychoanalytic, or sometimes called psychodynamic psychotherapy. Psychoanalytic therapy is a therapy that works with the deeper levels of mind, and sometimes that is called the unconscious mind. My belief is that mental health problems stem from early relational trauma and relational difficulties, which are then reenacted and replayed in later life. Psychoanalytic psychotherapy is trying to understand these patterns of behavior and relating and address them to achieve better mental health. Although I'm not fully trained CBT or systemic psychotherapist, I had training in those modalities and I would use them in a day-to-day work. So my approach is eclectic and depends on patients' needs. Some patients are only interested in puristic psychoanalytic psychotherapy. However, some would like to have a combined approach, eclectic approach. And I would agree that with the individual to ensure that it is a patient-centered approach. I'm currently a clinical lead for a team that works with patients who have been diagnosed with borderline personality disorder. However, I must say that I prefer the concept of complex trauma. It is more validating and less stigmatizing. It also implies that the current difficulties have origin in early relational trauma in childhood, especially with primary caregivers. National Institute of Clinical Excellence, NICE, does not recommend medication as the main approach to treating of complex trauma or borderline personality disorder. Instead, the psychotherapists are our main approach, and including DBT, CBT, EMDR, cognitive analytic, but I offer psychoanalytic, and although I use the elements of other therapies as well. However, when there is a need to prescribe medication, I would use medication as well. Um, and that is usually in the circumstances when the patient is experiencing a clinical depression, high levels of anxiety, or breakthrough psychotic symptoms. As a clinical lead for one of very few national gender identity clinics in the UK, I have extensive experience of working with the LGBT population. This population is very stigmatized and experiences a lot of discrimination. And I use my experience in relational therapies to address this and help them have fulfilling lives and fulfilling and satisfying relationships. My view of mental health problems is that they do not just arise in a vacuum, and they are always related to something that has happened to us either early in childhood or is currently happening. They're always connected with traumatic relationships, and sometimes these relationships arise in childhood and sometimes later on in life. I think there is a vicious circle between mental health and relational problems. So that mental health problems arise from difficult relationships, and then when they are established, relationships continue to be troublesome, and there is a vicious circle that one causes the other repeatedly. When I'm not at work, I really like spending time in nature, whether that is my own garden where I enjoy gardening or going for longer walks. I find that nature is very restorative. I also like the creativity and art. I paint and sculpt, and I believe that there is something very regenerative in art. I also frequently recommend my patients to engage in art and release their internal creativity. If you're interested in detailed assessments that include both psychotherapy and psychiatry, please contact Private Therapy Clinic. The what I can offer is a multimodal psychotherapy approach with the classic psychiatric assessment, detailed formulation, and care plan.